Hi, Ms. Ryan. I'm Dr. Seal. It's nice to meet you.
Hi, Dr. Seal.
How can I help you today?
I came here because my GI doctor has referred me to you because I have so much pain. I've got pancreatitis, and I'll be honest with you, I drank pretty heavy when I was a lot younger, and to the point that I got hospitalized a couple of times, and it was pretty bad. But then about 10 years ago, I stopped drinking because I had to, and it was already pancreatitis, and then that's when the pain started every day, and been killing me ever since. And so now I'm coming because I took my last pill last night, and I got to have a refill.
Okay. So you've had quite a battle with this pancreatitis. Sounds like you deal with a lot of pain.
I'm telling you, doctor, you don't even know. It's been going on for so long, and I just live with it.
Well, tell me about how severe that is. What would you say what number best describes your pain on average over the last week?
It's bad.
On a scale of 1 to 10, if 1 is not much pain and 10 is the worst pain you've ever had.
Then I'd say at least 10. At least 10.
So the medicine really doesn't help you?
Well, I mean, when I take that medicine, I can get it down to about 8. But it's not good. But I can get it to 8.
So the medicine helps, but you still have a pretty high level of pain.
Oh, yeah.
Okay.
Yeah, that's why I'm really hoping that I can go up, because at first you want me to tell you, I was first, they started me like with 5, and then on Lortabs, and then moved me to 7.5, and now I'm at 10, and that 10 is not even cutting it. I gotta have more than that. If there's any way in this world that you can give me more than 10, then I really want to request it.
Okay. Well, the Lortab 10 is the strongest one that we have, but we'll talk about what our options are in a few minutes. Let me get just a little bit more information, if I could.
Okay.
Let me ask you about your enjoyment of life. What number would you say best describes how during the past week pain has interfered with your enjoyment of life, with 1 being doesn't really interfere at all, and 10 is it interferes pretty much all the time?
With my enjoyment, I don't even remember enjoyment, but I'm going to say at least to 9.
So it interferes a lot.
Yeah.
You're not able to enjoy a lot of things.
I don't have much of a life anymore.
Well, what about your general activity level? What number would best describe how during the last week the pain has interfered with your general activity, your ability to do things?
Now, I'm going to work. I'm going to get up and go to work when I have to go to work if it's killing me. And sometimes it is. And I'm going to work because I have to eat. So I'm going to keep that going. But there's a lot of things I don't do, but I do work, and I have to do that. I have to eat.
So what number would you say? How much does it interfere with your general activity?
I mean, it's still 7.
Okay.
For anything.
So it interferes with a lot of things, but you're still able to work.
Yes.
Okay.
I am.
What other things besides the Lortab and the medication have you tried to control or reduce your pain?
I feel like I've tried everything.
Really?
But I have tried. I mean, I have a friend who talked me into acupuncture, and I did that 1 or 2 times. But I'm telling you, I think that was kind of a creepy thing, and I didn't like it. And I've been to the health food store. I'm going to be honest with you. I have a friend who's recommended some things with me, to me from the health food store, and that's helping a little bit. That's not helping me nearly what I need to have, but it's helping me a little bit. And I mean, I'm deep breathing, which I learned when I had a baby to get through pain, and I do that when I have to push. I just try to stay busy. And if I'm busy, that helps. And if I'm sleeping, that helps. That's about all that helps.
Okay. Very good. Very good. What about side effects? Do you have any side effects from the medicines that you take?
I get a little bit sleepy right after I take it. So when I get up in the morning, when I'm going to work that day, then I go ahead and get up and I take it first thing when I get up. So I got a good hour before I get in the car and go to work. And so I'm my pain level is a little bit down when I can get there to my first appointment.
Uh-huh.
And then, I am having problems with constipation.
Okay.
I
That's
am
pretty common with the opioids. I think we
It's
can
pretty
help you with that.
bad.
Okay.
Yeah, I'd like some help with that. I don't know if you recommend Metamucil or something, but I need something.
Okay. All right. We'll talk about that also. Let me ask you one other thing. If you're having a lot of pain and you take your pill and you still hurt a lot, what kinds of things might you do to try to get more pain relief?
I mean, just those things. I just deep breathe.
Mm-hmm.
And sometimes I just take a nap.
Mm-hmm. You ever
That's
borrow medicines from other people?
No. No, I don't do that.
Okay.
No, I don't. I wouldn't do that.
Mm-hmm.
I mean, one time I ran out, and my brother-in-law gave me something, but that was just one time.
Okay. All right. Well, it sounds like you just deal with a lot of pain all the
I
time.
am.
And you
I
work hard
am.
to deal with it and stay active. And we want to do everything we can to help you out. So let me go get I have some paperwork I want to go over with you, and I'll be back in just a moment.
Okay.